Thank you, Justin McGee, for giving us your experience on your surgery rotation. Can you go ahead and tell a little bit about yourself?
All right. Well, my name is Justin McGee. I'm from Fort Wayne, Indiana. I go attend The Ohio State University College of Medicine. I'm a joint degree student in the MD MBA program. I'm in my fourth year currently, or fourth year of medicine, fifth year of the joint degree program. Planning on going into emergency medicine.
Great, great. And Justin has agreed to talk today because I was curious to get his experience from how he felt the surgery rotation went for him, and also to get an idea of just how this goes for everybody. So we've had lots of questions about, but I've always had questions about how students learn in these rotations. And Justin, I'd be curious to know what parts of the rotation you found particularly useful in terms of where you learned. Did you learn most in the operating room? Did you learn in lectures? Did you learn rounding?
Okay. I will say well, surgery is a multifaceted topic, and I would say I learned best of the anatomy and specific disease processes in the operating room with the attending or the resident, pointing things out, asking questions about certain processes, and just about general surgical facts and medical background. I learned mostly with either one-on-one or one-on-two resident teaching sessions, or when we had a little bit of downtime between cases, just reading the case books. I use the NMS case book. I found that pretty helpful. Different question books, the USMLE surgery questions were kind of helpful. The pre-test questions were pretty helpful. As far as lectures go, I know our school has lectures fairly regularly. Depending on the style and who's teaching it, you learn more from some of the others. Like when they're more interactive and more case-based, I think it's easier to remember those. But when it's just a straight classic lecture, for myself, I know it's hard for me to really pay attention to those.
Right.
And I know for other students, it's an issue with trying to focus on just this pure lecture format.
Okay, so learning on the fly was from the other residents and in the operating room from staff was useful to you then, huh?
Yep.
And did you feel like you were studying for the test at the end, or did you feel like you were learning surgery for your career?
I would say, as far as getting close to the end, the books and questions I would say were most helpful for the test itself, but the lessons you learn in the operating room with the residents, I think it's more applicable to general medical careers if you're going to surgery or not. It just gives you a lot of things to think about. A lot of the residents and the attendees have a lot of good perspectives on what they're looking for in certain cases. Of course, it depends on the subspecialty of surgery you're rotating through, but they tell them what they pay attention to, the things they look at, things you should pay attention to just not outside the operating room when you're seeing the patients, or what qualifies for surgical abdomen versus not. How you look at I was on an oncology rotation and a trauma rotation, so for oncology, about what size and what kind of patient do you take to the operating room, what are the risk factors associated with that, and how they can manage that outside of the operating room.
Right, right. And as you went through your rotation, did your rotation make you feel more or less like you wanted to become a surgeon? Or can you talk about where you were coming in and when you left?
Yeah, when I came in, when I first came into medical school, I wanted to go into surgery. That was my general plan. Of course, I lacked a lot of experience in a lot of other things, but I thought, like, I come to medical school, this is kind of my plan. I've seen surgeries, I thought they were pretty cool. As I progressed through medicine, I found there were more things that I enjoyed more than I thought I would. When I took the year off, I had more time to think about what I want my career to be. But I still, it's that surgery in my mind. So when I went into surgery rotation, I was still playing like, this is probably what I want to do. Let me just go see how I feel when I do it. And when I went into doing it, I mean, I found most of the things interesting, but I feel like it didn't speak to me the same way other specialties, other types of medicine did. And I speaking with different attendings and different residents, they were always very helpful, gave very good advice about career and what you want out of life. And some of them straight told me, like, if you can see yourself doing something other than surgery and medicine, you should really consider doing that, because surgery is for people who really can't see themselves doing something else.
Yeah.
And if you're open, and they gave me good advice about what I want to do with my career. They were very applicable, gave good advice in general about how they chose their specialty, why they're doing what they're doing, other things they thought about doing, why they didn't do that. So.
And do you feel like students are treated differently based on whether they're heading toward a surgical specialty or psychiatry or into something else?
On my rotations, I didn't really experience that per se. I'd say the students who I let it be known that they're really interested in surgery, they get I don't want to say grilled, but they get kind of held to a different standard, and they'll be asked tougher questions and things like that in terms of background knowledge. But as far as experience with doing certain procedures or suturing, doing things like cleaning wounds or anything else that the medical students typically do, they gave fair exposure to everybody because this is stuff that'll be handy no matter, for the most part, no matter what career of medicine you go into, a lot of stuff will be happy, and they think no matter what you do, you should know how to do certain things. So.
Right, right. And you're heading into emergency medicine,
Yes.
right? Good. Okay. You mentioned some of the resources you used on your rotation for learning in the hospital. Can you go over some of those again? You use some pocket guides, some textbooks, and then
Yes.
go ahead.
I use the NMS is the red book. I can't remember the exact name of it. We refer to it as the NMS book. It's red. I use the USMLE Step 2 CK question bank. I got that for the entire year just to do throughout the rotations. I find those questions pretty helpful. There's not too many of them, so I supplemented that with the pre-test question book. That was pretty helpful. It goes over general things. It's not necessarily the same format as the shelf exam that we end up taking, but the questions are good just for understanding the basics and getting the mindset of how you should think about certain key phrases, presenting patients, things like that. I know some people use the case files book. I use that a little bit, but I personally like questions, but I don't like the going through cases that in depth. But a lot of people use primarily NMS, case files, or some form of questions, either pre-test or USMLE.
Okay. All the ones you just mentioned are paper books, right? Or
Yes.
are these in digital formats as well? Or
They are in digital. A lot of them are in digital formats. I know the USMLE Step 2 CK Bank, that's all in digital format. You can use it on your tablet or telephone. I know Pretest actually has an application. I don't know if it's on Android devices or not, but I know it's on in the iTunes store. You can buy the Pretest book, and they generate question banks. Pretty much the same questions as the paper book if you don't want to carry around the paper book. NMS, I know you can get it in a digital copy. They also have paper copies as well. Case files, I've also seen in digital copy as well.
Okay. And what other digital resources did you use? I mean, I see students use Wikipedia and Googling things all day long, and there's a fair amount of time you spend on your rotation, I imagine, at a computer terminal doing documenting.
So I use a lot of up-to-date, as far as documentation goes, and if I'm in front of a computer. Or actually, the app is actually pretty good for up-to-date as well. I use that as well when I need point-of-care answers for specific questions. If I know exactly what I'm trying to look for, just a general topic I want to review, if they have those, it gives you the basics. If you want to go more in depth, of course, you can get a textbook and kind of go through it. But if you're just looking for the basic rundown for what you need to know, you can use that. And if you want to go more in depth about certain things, of course, they have medical libraries are always accessible. Our school has a great digital library, so most of the textbooks are in a digital format that you can reach through the library website.
Okay. Yeah, I'm curious about that. It's common for universities to have subscriptions to various digital resources. How often do you just in the middle of your day on your rotation? How often do you access those versus just Googling or Wikipediaing something before going into the operating room or going to see a patient with diverticulitis or something? Do you ever just go to broad resources like Google and Wikipedia?
If I'm trying to look for something, if I don't know exactly what I'm looking for, I may use that as a general category when I kind of have a little bit more time to process what I'm thinking about or see the general topic and I know exactly what I'm trying to say. I'll take the information I find on Wikipedia or what I've just kind of basically learned on Google, take it to one of the resources, either find a specific article I'm looking for or look through the general textbook to get a more in-depth flavor of what exactly the format I'm looking for. Those are good for general things, but if I'm trying to look for something specific, say a specific surgical technique, reasons or causes for doing certain procedures or complications associated with those, I want to use the actual surgical resources because they're a lot more specific and a lot more usable than just the general information you find out on the web.
Okay. So,
at least once or twice a day, I think I'd use it. So I'd say, see a patient, general question. If I don't know exactly what I'm looking for, maybe use Google once or twice. Beyond that, if I use the digital resources from the school, 3 to 4 times, depending on the number of patients I have and what questions I need to answer.
So Google or Wikipedia is just sort of like a broad screening on a topic then.
Yeah.
And then when you go for a deep dive, you go to one of those other resources. Okay. Let's talk a little bit about the stereotypes of surgeons. I know for a lot of people it's an unpleasant rotation to come up there. So what stereotypes did you have or had you heard before your rotation or were you expecting coming in, and how were those true or untrue?
Okay. Things we usually hear about surgeons in general, they're very, some of them can not, I don't want to say harsh, but they're very firm, very direct, can be kind of loud. Some people think that surgeons can be arrogant or kind of really control heavy and kind of hostile. Also here they're pretty, for the most part, can be pretty laid back and relaxed, and they enjoy themselves and can have a lot of fun in what they're doing. Um, they're very technical focused, but as far as medical knowledge, it may not be that. I don't know. I don't want to say they're not bright, but depending on subspecialty, some people think some surgeons don't know a lot of medicine. They know what they do, and that's what they do. And beyond that, they don't know anything else. As far as going in, I think most of those stereotypes aren't necessarily true. I would say there's a certain level of confidence that's required to go into surgery. A lot of surgeons are very, I don't want to say firm, but they know exactly, they are very precise in what they're asking for and what they're looking for, and their expectations for how to run things efficiently. Most of them are very big on efficiency in their operating rooms. A lot of residents, they have a very high standards for what they do. Very driven, type A. I think you'd expect those, but as far as, I never experienced somebody who's really hostile. I think some of the best teachers I've had on any of my rotations have been the surgical attendings. Very helpful, very open, very understanding, but they do have high expectations, very specific things they're looking for when they're asked questions.
Mm-hmm. Did you have a particular teacher that you found inspiring, or a moment, or maybe even a favorite patient or funny story from your rotation?
I would say as far as most of my surgical attending or surgical oncology attendings were really cool. I like them, but I say as far as the best teachers go, I had two trauma attendings that I thought were very helpful and very educational. They helped me a lot with my career decisions. One was a guy named Dr. Lindsay. He's been at OSU for a while, but he's a really great, fantastic surgeon, great educator, great teacher. He'd take the students at least twice a week into his office just to talk about certain topics we need to know about, like fluid balance and replenishing fluids, and things to look for post-surgically, but also talk with us about general career advice, what we're interested in, the things we care about in life, perspectives on different things like family time, things like that, and gave us real honest advice about certain things and his perspective on the decisions we make and choices. Another teacher was Dr. Jones. He's a trauma attending, very big into hands-on education in the operating room and during traumas, letting students take charge and having certain responsibilities like doing the fast scan, making sure we're in there, cutting off disrobing the patient, getting ready for the turn. Very calm demeanor, very helpful. I never felt any hostility from either one of those individuals, and it just really made a good rotation, and I think they just helped me make my own career choices.
Great. So you mentioned something I found interesting in there about balancing family and career. Like someone gave you some career advice on that. How did they? I'm curious how you walked away from your surgery rotation and viewed surgery as a place where you could or couldn't have a family, or how it would affect having a family.
Okay. The advice I was given was basically, depending on in terms of medicine, I mean, a medical career is really what you make it, but certain specialties, especially certain subspecialties in surgery, have very different schedules, and you need to think about the kind of life you want to have for certain things. So like trauma, at least at OSU, they're on nights for an entire week, then off nights for a week or two, then go back on. So there's a lot of alternation and different things like that you need to be aware of. As far as time goes, you got to make sure you know what your priorities are in life. Surgery has to be a high priority, but I was told family, the other things, one of them at least has to be above surgery.
Yeah.
Just kind of knowing what you want. If you want to be really proficient and really good, it's going to take time. It's going to take dedication. You got to make sure you set up a family dynamic. Make sure you have the right person, the right partner to support you in doing that, and really just know what your priorities are in life and what you're trying to do. That's the biggest advice that I got.
Great.
And make sure you find people surround yourself with friends, family, and people who kind of understand that, and it makes things go a lot smoother.
Well, thanks a lot for talking to the Op Report. We appreciate your perspective on your rotation.
No problem. Thank you.
Take care.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.